What really makes you laugh, right, is that, okay, we tell you that we don't want to do examinations when you've asked for them. Yet, okay, let's say you've had a post-dates induction. So you might have accepted vaginal sweeps from 39 weeks every 72 hours. You've then gone in, you've been assessed for Cook's balloon or cervical ripening rods. So an examination for that. And then the balloon was put in, and then the balloon was taken out, and then 12 hours later we've examined you again for a propes, and then the propes came out, and then we examined you again to put in another propes and assess whether we can break your waters or not. And then we examine you to break your waters, and then we let you move around a little bit, and then labour might not start, so then we're going to start the hormone drip, and we need to examine you before we start that. And then from then we're examining you every 4 hours. But yet we have an issue, and we want to warn you that there's a risk of infection when you're asking to be examined, but we're allowed to do all those other examinations because they're part of our guidelines and policies. It's just like the double standards bugs me, and I know that's not what you're saying. You're asking a genuine question. And yeah, the chance of infection can increase, obviously, once the waters have gone and that sort of protective seal around the baby is no longer there. But we also know now that infection can still get in whether your waters are gone or not. So it's just like the whole, I asked to be examined and my midwife said no, but yet we were happy to do all those other examinations and have them double checked by someone else. Or then the midwife has examined you and gone out and told the doctors the findings, and then the doctor wants to examine you themselves just to check that we're correct or not. So it's just that winds me up, really. And if someone's saying, I want to be examined again because I think baby's head's there, or I feel like I just want to check before you start and put in the epidural or something, then just do it. Like, we've already been examining you all those other times according to our guidelines and policies. So if a woman's asking for it to be examined, to me, I find that more significant and a request that I'll do if a woman wants it, rather than declining and saying no and using my sort of authority over the situation. I hope that helps. My name's Marina Jordan, Positive Birth Coach. I teach online, face-to-face, in-person groups and one-to-one, link in bio.